Let's talk about the dangers of not discussing periods. I've had more than one incident where a patient became critically ill from complications of their period, but was previously told by a parent or a caregiver that they shouldn't talk about their period. A common practice is for older women in the families to teach younger girls to keep their periods completely hidden. No one should know that you're on it. No one should see or encounter any of your menstrual products, clean or used, and you certainly don't need to talk about it. While I acknowledge the sanitary benefits of properly disposing of menstrual products, the social benefits of avoiding oversharing, and the character benefits of toughing through normal life changes, this practice can actually be harmful. I had a patient who came to the emergency center with severe anemia. Her blood count was 1/3 of what it should have been. Her mom had told her when she started her period that periods were normal. They didn't need to know when she was on it, and they didn't need to talk about it, and that she'd just keep pads stocked under the bathroom counter. Her mom hadn't noticed that her 11-year-old was working her way through her third box of pads. She required blood transfusions and intravenous hormone therapy due to her symptoms. Her heart rate was elevated. She was super dizzy when she walked and too lightheaded to bend down to tie her shoes. Her mom cried when she learned she'd been bleeding for well over a month and had been too afraid to talk about it. We don't need to promote silence. We need to promote understanding. A period that lasts longer than 7 days is abnormal, especially in the adolescent years. Changing a pad or tampon more than once in an hour is too frequent. Symptoms of anemia are dizziness, headaches, fatigue, and shortness of breath, and require evaluation. Periods are normal, but can become abnormal. Our girls need to know that they can tell you when the abnormal occurs. The difference can be critical.